I've watched.
I was a nurse administrator for 18 years in a major New York City medical center. I was strictly conventional. I was indoctrinated as a nurse manager. And then came the day when I was diagnosed with a number of chronic illnesses, because working in the hospital is very stressful. So it turned out I had chronic fatigue syndrome, and I was living to the tune of 13 cups of coffee a day in order to stay awake at work. I had acne, and they treated me with lots of antibiotics, so I developed very severe candida, for which they gave me more drugs, which had more side effects. And finally, with all the caffeine in my body, I was told that I had precancerous breast lesions and it might be a good idea to have a bilateral mastectomy. And that was my tipping point. It was at that point that I just decided, I don't think I want to go this conventional route, because they're loading me up with medications. They wanted to put me on thyroid medications. And then, of course, running the oncology units as well. I know that we treat people with cancer with chemotherapy and radiation and surgery. And I just didn't want to go that route. And that was when I learned about the Tri-State Healing Center and the work that Carrie Null was doing. And I was intrigued with the information that I heard. And I did my homework. I did a lot of reading about all the work that he was doing. And I went ahead and I worked with intravenous ozone therapy as part of a comprehensive protocol that I was given by Gary Null.
Well, the symptoms that I was experiencing before I was diagnosed officially with multiple sclerosis was dizziness, extreme muscle weakness, vertigo. If I really wasn't focusing, you would think that I was a drunk person because the slurred speech would be that bad. I go to the neurologist, they give me an MRI, they give me the spinal tap, it comes back, multiple sclerosis. Now that it's been 3 years since I've started and a little bit over a year since I've had my diagnosis reversed, I could tell you that in conventional medicine, their perspective of multiple sclerosis, and holistic medicine will agree that the #1 cause for is inflammation. Conventional medicine does not say, well, okay, well, the inflammation is caused by X, Y, and Z, and these are the things that you could do to either stop inflammation or reverse the inflammation. No, that's what holistic medicine does. Conventional medicine doesn't offer that approach at all. Instead, the primary approach is, here's the drugs to help make your life a little bit more comfortable, and you better prepare yourself and prepare your family to adapt to the inevitable handicap that you're going to eventually become. So build the rail to your house, because eventually the wheelchair's coming. No one has ever been cured with any medication. No one has ever reversed anything with any medication for multiple sclerosis. The only reversal that I've seen with multiple sclerosis is through holistic, natural healing, where you eliminate what's causing the inflammation to occur in the first place. The hard work was the diet change, not taking in any more foods that produce inflammatory responses, getting ozone therapy, which is so important to reversing multiple sclerosis, because what causes inflammation in the body, you have heavy metals, you have viruses, you have bad bacteria, and the ozone just goes in and just sort of sifts you like you're sifting through gold, and all the impurities come up. Well, it's the same thing with the ozone therapy.
I suffered from end-stage Alzheimer's. I couldn't dress myself properly. I would get up to look for things. I wouldn't remember what I was looking for. I didn't bathe. I never got out of the sweats. I went from the bed to the couch to the bed to the couch. Previous to that, I had had a very high-profile career in advertising, and I had also taught at NYU. In 2007, I was at the Center for Brain Health, and they were doing a specific study on me. A friend of mine suggested if I was going to have a spinal tap, I might as well ask them to look for Lyme. They found Lyme in my spinal fluid. It was brought to my attention by Gary Null that ozone might be a wonderful way to treat Lyme disease. Today, my life is thoroughly changed. I have a very rich life of friends, I have visited my relatives in the Midwest. I brought 3 people who are disabled to MoMA and toured them through the different collections. That is especially exciting because the reward in giving to people is that it's like me reading 40 books, even though I'm there to teach.
I take my temperature and it's 105 degrees. So I go see a doctor at Mount Sinai, this doctor who is a specialist in infectious diseases. They take a blood test and they say you have Lyme disease. The symptoms included terrible joint pain, muscle pain, insomnia, chronic fatigue, so I couldn't sleep at night and I couldn't stay awake for very long during the day, and yet I couldn't actually get into a sleeping state. I was just in this this numbing sort of fog that's very, very debilitating. I had a 6-week protocol of ozone injections. I was feeling considerably better. When I come back for the subsequent ozone injection, I don't take a cab. I ride there on my bike under my own steam. And I have an additional 6 weeks of ozone injections, and all symptoms are gone.
I had Lyme's disease very badly. I had vertigo. I couldn't get out of bed. I had body aches. I was in so much pain. I didn't realize until the pain started letting up how much pain I was in. Shortness of breath. I could hardly walk from here to you without having to rest in between. I was on antibiotics for about 60 days, which did absolutely nothing for me, but probably made me sicker. I went to Ozone a little over a year. After the first 3-4 treatments, I noticed my eyesight had improved because my eyesight was something else was dimming. And after 3 months, I was able to bring myself in and out of the city and to walk down the street by myself. I am going to start and teach my first yoga class tonight. I haven't taught in about 5 years, so I'm really excited.
I had Lyme disease and Epstein-Barr, and the symptoms were mainly, as far as I was concerned, fatigue and mind fog or brain fog in the evening. I did not get orthodox treatment because I didn't know that I had these problems. I would take naps during the day. I found I had less energy to do things during the day. I would go to bed earlier. I've been going 3 times a week for 2.5 years getting ozone therapy. My mind is clear all the time, including in the evenings after dinner until bedtime. So far, it's been highly successful.
One of the most common problems that I've seen ozone therapy help is herpes. People with herpes are devastated by it. Conservatively, it's estimated 50 million Americans have it. I've seen it show up, for example, in a person's face who had it coming out of his nose and walking up the side of his face to his eye. He had gone blind when it came out his other nostril in one eye, and when I saw him, he was worried because he felt that it might go blind in his other eye. Fortunately, I saw that the ozone therapy stopped that from happening, and he never lost his vision, and he completely got rid of the virus from his body.
My original conditions, I had really, really bad allergies, and I had viruses. I was not aware that there were viruses at the time. I just knew that I had tonsillitis as a child. I hadn't had tonsillitis outbreak in 20 years, and then all of a sudden I began to have them very, very frequently. When I found out that it was actually a herpes virus, I had no idea that I even had herpes. I went to the doctor, they gave me the medication. It would alleviate it for a while, and then of course, inevitably I would become stressed. I would get my allergies that would kick in the virus as well, and then I would get tonsillitis again. This went on for about 3 years, back and forth, taking medication. The medication didn't help. It would make me sicker. It would remove whatever the original symptom was, but then I would be tired, lethargic, couldn't function. My head wasn't clear, so I wasn't thinking clearly. They put you on drugs, and it is like that feeling like you're on drugs. You can't think straight. After a while, I just stopped going to the doctor for help, and I just figured I'll just suffer because then it'll pass, and that's better than being on the medication. How I even learned about ozone and alternative therapies was that my husband was sick. He had MS, and he had an absolute reversal. I began to see him getting better and better and better, and he went from being sick to being healthier than I was. And I said to myself, well, if this is helping him, let's see if it could help with my allergies. Let's see if it could help with my viruses. So I began to see the same doctors he began to see. The diet changes and the vitamins helped with the allergies. I no longer have allergies at all. but it did not help the virus. It helped, but to a certain extent, I still had outbreaks. Not as often. It went from being, 6 outbreaks a year to 2 outbreaks a year. So it did help, but it wasn't completely gone. That's when I began to do ozone therapy. And with ozone therapy, I've been doing it for a year now. I haven't had an outbreak at all. I don't get the symptoms anymore. Once in a while, if I'm under extreme stress, I'll feel like the tickling on my throat, and I know to up it a bit, go twice that week instead of just once. So I know that I'm on my way to completely overcoming it. The virus people will never admit that they have viruses because they're embarrassed. Nobody wants to say I have herpes. But it's very, very helpful, in particular with herpes.
Well, it started in 2005 when I had a foot surgery for a neuroma, and I had it removed and it didn't work. And I ended up having a second surgery in November of that same year. Also did not work. I just went back to work with pain. I was told I needed peripheral nerve surgery, and I had that done. They took a graft from my ankle and put it in my foot, and it's been nothing but pain. The sympathetic nervous system just keeps firing, and it just fires and fires, and there's nothing to stop it. I had all kinds of pain management procedures. I had a dorsal column stimulator trial. I had epidurals, sympathetic blocks, you name it, I tried it. Nothing worked. And then I was put on multiple antidepressants and anticonvulsants. I ended up having tremors, severe headaches, like a Parkinsonian type syndrome where I couldn't walk straight, so I had to stop taking those. But one of the worst symptoms was what I call brain freeze. It's like if you drink something very cold too fast and your brain actually freezes. I would have those attacks from minutes to hours. And I just had to wait for them to go away. It got to the point where I was sitting on my couch morning, noon, and night in pain, praying for death. So I started the ozone, and within 2 months, the brain freezes were gone. I started to have more energy. I was able to at least take care of my home, my family. I was able to go out and do my gardening again. I had hope. For the first time in a lot of years, I had hope. People go into it thinking that you're going to start the ozone and it's going to be a cure, a straight up cure. And it's not. It's a process. And it takes time for the ozone to do its work. But my bad days are nothing like they used to be. I mean, on my bad days, I'm still doing things. I'm still functional. I have a better quality of life.
I was diagnosed with breast cancer. I had no symptoms. At the time of biopsy, the cancer in the right breast was removed with the margins because it was very small. My breast surgeon recommended a mastectomy. I decided to have ozone therapy because I wanted to strengthen my immune system as much as possible in preparation for the surgery and the recovery. I had 10 sessions and I never had pain. After the mastectomy, I was back to work in 3 weeks. And I attribute my quick recovery to the ozone treatments.
I was diagnosed in July 2009 with pulmonary fibrosis. I thought shortness of breath was due to aging. I went to a pulmonologist and they had offered me steroids, which I didn't want to take. They told me that it was incurable and eventually would lead to death. I have been taking 4 treatments, and I did notice slight changes after the first treatment. And at first I thought maybe it was just I was mentally hoping for a change, and I saw I wasn't coughing as much, and the episodes seemed to be less in length. And as it progressed with the treatment, my family noticed. My daughter noticed there was a difference. My son said he could hear it in my voice on the phone. The coughing itself is not as convulsive and extensive. It's not as exhausting. And I'm coughing less frequently during the day. I have more energy. After the last treatment, I felt a more relaxed breathing pattern. You kind of focus in on your breathing pattern quite a lot. And I felt more relaxed about it. It wasn't as stressful. I didn't have as much tightness in my chest. So those things I thought were very positive. And I'm looking forward to more ozone therapy to improve my condition.
Once I saw a woman, actually a registered nurse, who had Bell's palsy. And after getting ozone therapy for just a couple of weeks, her Bell's palsy virtually disappeared. Obviously, it destroyed the viruses that must cause Bell's palsy, or it wouldn't work. And in this case, it got rid of it completely, rather than this poor woman suffering from Bell's palsy, where the face just sort of drops and droops on one side, and can be very uncomfortable, to say the least, if not even painful at times, that you'd live with for years, sometimes many years, or permanently, went away completely.
I developed Bell's palsy. It comes on very, very quickly. The immediate response was to go to a neurologist and rule out anything that may have taken place, you know, like a seizure or anything of that sort. It got progressively worse after a few days. It was considered to be very, very severe. The whole right side of my face had no feeling. My eye was completely drooping. My mouth was completely lopsided. As far as any traditional medication, I don't even recall, because I wouldn't pay attention to it, because side effects and success rate was non-existent. The outcome of the ozone was that the paralysis began to subside. And probably within about 5 months to 6 months, I would say that we were about 90% better.
My problem was thyroid dysfunction. I started reading about natural healing and came up with ozone therapy. Started taking it on a regular basis. Within 6 to 8 months, my condition got a whole lot better, at least 80% better. I no longer have sleep apnea. I no longer take thyroid medication, which I'm very happy to say. I'm feeling much healthier. With this ozone, I feel more alive, more energetic. I've noticed that my nails have gotten stronger. I've noticed that my hair is stronger. And I've noticed I'm happier.
I had hepatitis C. I don't know if I still have it. I got to get another blood test. I'm feeling a lot better. Definitely. When I woke up in the morning, I felt tired all the time, like I never slept. Now, I have more energy. You know, I mean, I work construction. I go home and I exercise, I lift weights, feeling much better.
I was a nurse for over 10 years on a medical floor. The staff that I work with, we were extremely diligent. But when you send people home with bed sores or they come back and forth from nursing homes, you just don't see them getting better. Actually, when they were with us, we were so diligent, we would see some improvement. But then when you sent those person back out into the real world or back out to a nursing home, they came back worse all the time. Bed sores are just horrendous. It's a hole in someone's body. It opens up the skin to many, many infections. It does happen very easily when people are compromised, poor nutrition, and they're not turned and positioned. It does come about easily, but it should never come about. And once it happens, it's very difficult to reverse. I'm a caregiver of a 79-year-old gentleman, which is my father, who has a bed sore as a result of being in a rehabilitation unit for a post-stroke. I had actually gone in at one point and watched a nurse pull off a dressing and then just go put another one back on. And I had stopped her and said, wouldn't you cleanse that wound prior to putting on another dressing? And she said, oh yeah, and then she did stop. And after we got him out of the hospital, I couldn't get the wound to come back, and it kept getting worse on me, and I didn't understand until we had the wound cultured, and there was E. coli in the wound. He's had approximately 12 treatments of ozone. He does them 4 days a week. The results are phenomenal. Being a nurse in that setting, originally on my own prior to taking care of my father, you don't see wounds heal that quickly and look so good. The skin is returning, it's extremely pink, it's excellent growth. You could just see it's good, healthy tissue in there. We've 95% of the wound has no decaying tissue in it. We've gotten rid of all of that. The gentleman that we took him to a wound care specialist, because we need traditional medicine to get certain treatments. We only saw this gentleman 1 week, And 2 weeks later, we had seen him again. He had to go back to look at the original pictures because there was such a change in the wound.
Very serious medical problem is diabetic neuropathy, peripheral neuropathy. This is where diabetes, type 1 and type 2, causes the nerves to lose sensation. People can develop gangrenous ulcers because of it, just from walking on them. And I've actually treated patients with diabetic gangrenous ulcers and watched these ulcers start to improve. In this case, we not only use direct intravenous therapy, but we can inject right into the gangrene, right into the ulcer itself. Usually they're painless because the people have lost all nerve sensation. But one way or another, you watch the ulcers start to drain and close, heal and get well, and you've saved their foot and leg. It's estimated that 30,000 people a year lose their feet and legs from gangrenous diabetic ulcers, and we've been able to save it. But this is an interesting thing. There's a couple of dozen scientific articles worldwide on doctors that have used it exactly the same way to get the exact same benefits. And one of the reasons for that is that ozone helps the red blood cells become rounder, so they flow smoother and easier in the body. And they make them more flexible, so they can slip through hardened, narrowed, clogged, or tightened arteries better. At the same time, it destroys the infections that are local. Now, traditional medicine can't fix this problem as easily because the antibiotics that they're giving just can't get in there. Ozone gets in there, so it acts as the antibiotic that's needed both topically by injecting it and intravenously through the circulation.
In the last few years, I've been treated a couple of times for diabetic sores. I've been a diabetic for more than 35 years. In one particular incident, I had 4 ulcerative sores on my feet. The skin had actually started to turn black on these sores. After the ozone, after about a week or 10 days, the color of the darkness of it got less and less. It took a while to heal that, but considering that it was as bad as it was, within 2 months it was completely healed. If I didn't go for the ozone, maybe I could have lost a foot, or amputation is always so prevalent with diabetics. So I always have to be mindful of this. Another time I had a burn on my arm and it was infected and it was all red and inflamed. The doctor that I was seeing did a direct injection into the wound itself, and within 2 or 3 days that virtually turned around and cleared up.
I have diabetes and I have a lot of side effects of diabetes. My vision is bad, or had been bad. Had detached retina and a lot of vision problems in my left eye, and doing the ozone has increased the circulation to my eye, where my eye has improved dramatically.
My dad is an 83-year-old diabetic, and he came down with an infection on his toe. He's a veteran, so he was admitted to the VA hospital for treatment. I was told that if they couldn't heal the infection, that it was very likely my dad would lose his toe. The hope was that the antibiotics would do the trick, kill the infection, and the toe would be fine. Unfortunately, I didn't see that. That never happened. He was there at least a week, if I remember correctly. And the toe was getting worse and worse, and finally I asked that he be discharged because I felt I had to look into other means to see if I could do something about this toe. He had approximately 20 treatments of ozone, 20 plus actually. We started 10 at a time. After the initial 10 sessions, we started to see results with the toe. It gradually started to return to normal. In all likelihood, we saved his toe and possibly his foot.
The symptoms that I was experiencing were varied on an everyday basis. It was never one particular thing. It was just a sense of an all-over sickness, just feeling literally like I was on death's door and I had absolutely no explanation for it. There were moments where I felt like I had something crawling under my skin, extreme fatigue, nausea on a constant basis. When I would go to doctors and explain what my symptoms were, they would really, at the end of the session, tell me that I needed mental help, that nothing was wrong, and that I should maybe seek a psychiatrist, because I would insist on further testing or whatever they could do. I just felt so helpless. I really didn't know where else to turn. I was able to start going into health food stores and speaking with nutritionists and explain to them what I was feeling, and able to find out what I had been suffering from, that there was an overgrowth of yeast throughout my entire body, systemically, causing all these symptoms. And at first when I heard about it, it really didn't make sense to me, because when you, as a woman, you think of yeast, you think of it in one particular way. You don't understand that it can run through all your organs and your bloodstream, and it affects every system throughout your body. I had Ozone 3 times a week for 3 months. I feel like a flower that used to be wilted, that needed water and nutrients, and now I'm able to stand up and I feel better. I feel an overwhelming sense of calm.
I had an upper respiratory infection that did not respond to medication, and it lingered for, I would say, maybe 3-4 weeks. And I wasn't feeling well at all. I had about 5 or 6 Ozone sessions, and that seemed to do the trick for me. I would feel so much better after the sessions.
I was traveling for the past 2 months internationally in Europe, and the last couple weeks I spent my last week in Spain and came down with a horrible flu and a fever, serious coughing, and I had to get on a plane back to the United States. And when I got back to the United States, I was really fatigued. I was really weak, so I was supposed to only stay for 2 days in New York, and I stayed in a hotel. The next morning I woke up with a rash covering my entire body. The day after the first Ozone treatment, the rash healed significantly. It almost actually disappeared in 1 day. And by the second day, it was pretty much all gone.
I once saw a young girl, about 30 years old, who came back from the Gulf War with Gulf War syndrome. Her legs were swollen. She was as sick as I've ever seen a young person get. She had been injected with all sorts of things going there, plus she had been breathing in all the horrible air from the burning of the oil fields and everything. After a relatively short time, actually in just a couple of months of care, she turned around.
I had PTSD, Persian Gulf syndrome. My foot and my left ankle were incredibly swollen. It was very despairing to not be yourself, to not be able to function and have energy. I was having Ozone 3 to 4 times a week, and I did that for a good 2.5 years. I saw initial results pretty fast. I'm going to say 3 months, but then slowly over time I started getting my energy back. I started having more energy. Getting out of bed was easier. I became more active and more productive. And I did the roller coaster thing. I had good days, I had bad days. I had good days, I had bad days, but then the good days started to outweigh the bad days. And it was really a life changer.
I was diagnosed with rheumatoid arthritis, with joint pain and swelling on my hands, my ankles, my knees. In the beginning, I couldn't brush my teeth, I couldn't brush my hair, I couldn't shower, I couldn't get dressed, I couldn't get out of bed. I was almost completely bedridden. I did Ozone the first time. I did it for about a week and a half, and then I went back to school. And on my next vacation, which was this summer, I've been doing it for about, I believe, daily for about a month, if not a month and a half. And I noticed the improvement again with it in the morning, where normally I would get up in the morning, stiffness of my joints and swelling. Usually it would take me about 3 to 5 hours to start being able to move my hands better, grasping things better, whereas opposed now, after I have the Ozone treatment, usually within about an hour, if not less, the swelling is down, the stiffness is less, and I'm able to move about better. As of right now, I do believe it will be cured, or if not, put back into remission.
I've had a lot of trouble with my shoulder. Over the years, it's become very arthritic, and I've had a lot of pain. The Ozone therapy can help arthritis. So I started 3 times a week, and I realized that I wasn't getting all that pain during the night, but I feel that the Ozone is doing something. So I'm going to continue.
My eyelids were red and itchy, and it sometimes felt like something was in my eye, although it wasn't. And for approximately 1.5 to 2 years, I've been treated for it prior to having Ozone, and it didn't make a difference because nothing helped. And within having 8 weeks of Ozone, it's 100% gone. The doctor was very shocked because it's totally disappeared, so I no longer have that condition at all.
I was first diagnosed with ulcerative colitis, and the symptoms for that is ulcers in the large intestines that could bleed and be very painful. All the medicine made me worse. The other condition is called pyoderma gangrenosum, which is a disease that they think stems from the ulcerative colitis. And that's a condition where you get ulcers mainly on the lower extremities, but it could go anywhere. And these are very painful ulcers that could get infected, and they don't even really know how to treat it or get rid of it, that they think you're going to have it for the rest of your life and just be on autoimmune depressant drugs. I think the Ozone has done an amazing job, because just knowing how bad people are with my condition, I actually cleared it up for 2 years. People with pyoderma gangrenosum, a lot of them can't even walk. They're on disability, their pain's constantly in a hospital. Ever since I've started ozone therapy, I've never been in the hospital for infections. I've never been on an antibiotic for infections, and I've been able to work. I've been able to do other activities I want to do. Still not fully cleared yet, but I feel it's helped a lot, and it could be a lot worse.
My problem was the pain in my legs, which was something very recent that I never had before, long-term allergies, and mold problem in my apartment. When I'm not in New York and outside of my apartment, my health is much better. I also have a problem with candidiasis, which I had for a long time, owing to massive doses of antibiotics. So that's what I was being treated for with the Ozone. But there was an immediate reaction with the pains in my legs. They just disappeared after 2 weeks. And for the chronic fatigue, that took about a month. I started feeling better. In June, all through June, I was still very tired, but in July, I started feeling much better. And significant improvement from the ozone therapy.
I had lung problems. I was coughing a lot. Whenever I'd catch any kind of head cold, my lungs would feel it very bad. I've done ozone for about 2 years. The results came on the quick side. I seen them, I would say within 2 months, I felt a lot better. So ozone has gotten rid of the cough, and my lungs are a lot better than what they used to be. I'm still going for it. I still have, it's not completely out, but it's a lot better than what any doctor or drug would have done.
I had a lot of lung congestion, shortness of breath, and I've noticed my lungs are clearing. I definitely have much more energy since I've been doing this. My endurance is greater. So I'm doing it really for both a health benefit and also to solve an issue where my capacity to breathe was inhibited. And so now I find like I've been running again, which is something I haven't done for a couple of years, and it makes me happy.
Okay, Jonathan was diagnosed with autism in 2005, I believe. He was lethargic. He was abusive towards his cousins. He would do physical harm to himself. He was cognitive abilities. He wasn't able to learn anything. And he couldn't sit still in the classroom. That's one of the reasons we found out he had autism.
I was hitting a lot of kids and banging my head in the classroom. And I started to get angry, and I pointed, and I couldn't speak.
He received the MMR vaccine. He got a fever exactly 2 days after he received the vaccine. He lost his speech, where we had to get speech therapy for him for about 1 year. And my wife happened to listen to the Gary No Show. She heard about a protocol on that program on that particular day. The protocol consisted of vitamins, exercise, chelation therapy, meditation, and yoga. To this day, he still does most of the protocols. Well, we have a regimen of vitamins in the morning, protein shakes with fresh organic fruits, soy milk or rice milk. We all change our diet for the better. If Jonathan was to be diagnosed today, I believe that he will not be diagnosed with autism.
There's a condition that exists called chronic fatigue syndrome. Finally, the doctors in this country admitted that such a thing existed. And it's caused by many different illnesses, one of them being the Epstein-Barr virus, a herpes virus that's also known as mononucleosis, the kissing disease. I remember one woman, she'd been married just for a few years. She could barely get out of bed, and then often after just getting washed and dressed, having to go back to bed for the rest of the day because of the extreme exhaustion. Well, I saw her over a period of time get better and better and better, to the point where 10 months later she was out seeking a job.
I originally got into ozone therapy back in 2005 when I'd already been suffering for a long time from chronic fatigue syndrome. I had reached a condition where my immune system, which is always affected by this disease, had gone through a major collapse, and I was very, very, very sick and largely non-functional. Orthodox medicine had very, very little to give me. We were able to work out some drugs that could increase the amount of dopamine in my body, which to a point helped. But by the time I first heard about ozone, I'd already been in a state of collapse for nearly 18 months that no one in Orthodox medicine could really help me with. It's like being a car without any gas. Maybe someone comes along and puts in a cup of gas at a time, and you putter along a little bit, and then all of a sudden you're out of gas again. There's a low energy level, you feel sick, constant infections because your immune system is down. So everything that's in your body or in the atmosphere doesn't stay suppressed as it does in normal people. It comes up again. So I had all these various infections, and one of them was chlamydia that antibiotics couldn't knock out, and the ozone knocked out the chlamydia. It also knocked out the mycoplasma, which normal antibiotics are supposed to be able to knock out, but they didn't. Ozone really got me up and around again. When I first had it, after about 3 months, I would say, I was really a changed person. I was able to write again. I was able to socialize. It really, really helped a lot.
I have hepatitis B. I didn't want to do the conventional treatment, so I started doing quick research on alternative approach. One of the first things that I came across was some recording online of Gary Null. One of the highlights was the intravenous ozone. The result was tremendous. So my viral load dropped down from 150,000 copies per milliliter to 1,700. And I was stunned. Also, my doctor, he was amazed by the result. I'm open to sharing my experience because people outside should know that there is solutions outside of the existing paradigm. It's general belief that just using herbal supplements, such a big drop in the viral load is not possible in such a short time. So my belief is that the final blow was delivered by the ozone therapy.
Various flu viruses and rhinoviruses are very common, and people in this country lose days, if not sometimes weeks of work. We've been told that there's no cure for these things, you just sort of have to get over it. Well, that's not true. Ozone therapy has been shown, and I've seen it help many people with colds and flus. In fact, if you think you're getting one, I've seen people who have been treated who know they're coming down with it, and as soon as they get the therapy, the next day they wake up and they're perfectly fine.
About 4 years ago, I found myself coming down with the flu and a cough. And try as I would, all the methods that usually worked, I couldn't get rid of it. It got worse and worse. Within a week after starting the intravenous ozone, my cough was gone.